Hi everyone, my name is Clarissa Layden. As Dermot said, I'm a PhD student at the School of Public Health and a Teagasc Walsh Scholar, and I want to discuss today the carbon and water footprints of Irish dietary patterns and whether simply eating a healthy diet will improve environmental sustainability. So this morning, Dr. Mack touched on some of these points, but I just want to briefly give a background on diets, population health, and the planet. In 2010, the Food and Agricultural Organization and Biodiversity International organized a scientific symposium on biodiversity and sustainable diets. One of the major outcomes of the symposium was that a consensus position was reached on the following definition of sustainable diets, and they are those with low environmental impacts which contribute to food and nutrition security and to healthy life for present and future generations. Additionally, they must be protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair and affordable, as well as being nutritionally adequate, safe and healthy while optimizing natural and human resources. So this definition helped articulate in more concrete and operational way for the future direction of food security and sustainability. And the 4 pillars of a sustainable diet taken from this definition, health, socioculture, economics, and environment, have provided a foundation upon which research into food systems has grown. More recently, in 2019, the Lancet Commission released 2 influential reports. The first called for a unified approach for dealing with the most important public health issues facing the world: obesity, undernutrition, and climate change, for which the report coined the term the global syndemic. The second report was the EAT Forum, in which experts identified unifying dietary principles that best promote the health of people and the planet. They proposed the Lancet reference diet for countries to apply. On the climate side, the recent Intergovernmental Panel on Climate Change report marked a significant change in recognizing links between food and the climate crisis. This, along with the international agreements on climate change mitigation and biodiversity protection targets, there is an overlap between changing the food system and the Sustainable Development Goals. Therefore, achieving Sustainable Development Goals go hand in hand with the food system transformation that is required. So, the image here on the left shows the 9 planetary boundaries within which humanity can continue to develop and thrive for generations to come. Crossing these boundaries increases the risk of generating large-scale, abrupt, or irreversible environmental change. We are currently exceeding many of the planetary boundaries, and agriculture, shown with the black dots, plays a significant role in pushing the Earth system towards, or in some cases over, the boundaries of a safe operating space for humanity. In addition, a number of papers and reports have quantified the environmental impacts of our food system. There are many ways in which food production impacts the environment and depletes natural resources. Food systems are responsible for 1/3 of global anthropogenic greenhouse gas emissions. Agriculture accounts for 70% of freshwater withdrawals, in addition to the other impacts shown here and many more. In addition to the environmental impacts, over 30% of food is lost or wasted each year. This number is even more striking given the number of hungry people in the world. Further, the ubiquitous supply of unhealthy food is driving diet-related diseases in both adults and children. So all of these issues and effects signify that we urgently need to change our dietary patterns and food practices, particularly in high-income countries, and change how we produce food. So the Eat Lancet diet, as I said, was created with both a health and sustainability perspective. We compared, as part of the SUHI project, how Irish dietary patterns adhere to the recommendations. The dietary data was taken from the Mitchelstown cohort, which is a cross-sectional study conducted between 2010 and 2011 in County Cork, Ireland. Data was available for 1,862 participants aged 46 to 73 years. The bottom of the graph is the food group components of the Eat Lancet diet. There was no recommendations for beverages such as caffeinated beverages or alcohol. Potato intake in the Irish diet was double the recommendation. Red meat, eggs, and sugar intake were also all above the recommended Eat Lancet upper range. There was negligible intakes of soy and nuts in this population, and fruit and vegetable intake was within the recommended Eat Lancet range. I want to mention that one of the limitations of dietary data collection is that it underestimates what an individual truly consumes, particularly healthy versus unhealthy foods. So the Mitchelstown study used a food frequency questionnaire, which assesses habitual diet, asking participants about the frequency with which they eat foods. But the box on the right shows some intakes of food consumed from the National Nutrition Survey. And this included a representative sample from the Republic of Ireland of 1,500 adults and used different dietary assessment methods. So their method was a 4-day semi-weighted food diary. But I just want to show that dietary intake was much higher in this sample than the Mitchelstown sample, and average fruit and vegetable intake is much lower, and the intake reported in the National Nutrition Survey is well below the recommendations of the Eat Lancet. So when we assess the environmental impacts, we link food items to greenhouse gas emission impact factors, which are reported in kg of CO2 equivalents based on life cycle assessment literature. Greenhouse gas emissions in this case refer to methane, nitrous oxide, and carbon dioxide. The CO2 equivalent is a metric measure used to compare the emissions from various greenhouse gases on the basis of their global warming potential by converting amounts of other gases to the equivalent amount of carbon dioxide. So the average dietary carbon footprint of Irish diets in this sample was 6.8 kg of CO2 equivalents a day. Males had a higher carbon footprint and dietary impacts declined as the population got older. To remain within the planetary boundaries, greenhouse gas emission targets have been proposed in the literature. The targets were applied at the current population level, which would be a target of 1.6 kg a day, and at the projected population level in 2050, that would be a target of 1.3 kg of CO2 equivalent a day. So Irish dietary patterns are currently exceeding both current targets and projected targets for greenhouse gas emissions. For water use or freshwater use, the average dietary water footprint a day in this sample was 425 litres. Females had a higher water footprint, and again, the dietary impacts declined as the population got older. With regards to the planetary boundaries, again, the targets were applied at the current population level, which would be estimated at 678 litres a day. And for a projected population in 2050, the target would be 559 litres a day. So currently we are below the recommended water footprint targets, but obviously these are just estimates and there are uncertainty ranges. So when we took this Mitchelstown cohort sample, we stratified them by sex and also their adherence to healthy dietary practices. When comparing the least healthiest to the healthiest group, those with the least healthy diet had the highest carbon footprint, but a lower water footprint. Females in both two groups had the highest water footprints. This was almost 500 litres of water used per day in the healthiest group. The ranking of foods changed within the groups, as you can see in the boxes on the right. So red meat continues to be the biggest contributor to dietary greenhouse gas emissions in both the least healthiest and most healthiest group, with processed meat being the second biggest contributor in the least healthiest and fruits in the healthiest. For the water footprint, caffeinated beverages and cereals were the two food groups with the biggest contributions to water footprint. So these findings of contribution and the water and greenhouse gas emission footprint found highlight the need for caution when determining the components of a climate-friendly diet. The sustainability credentials of a diet can change depending on the environmental impact metric being assessed, and also the components of the diet, because generally speaking, foods that have a lower greenhouse gas emission may actually have a higher water footprint. So just some conclusions on the work presented. Our food system, as we've talked about this morning, needs to change. The scientific community recommended that this change is orientated towards the UN Sustainable Development Goals to ensure that future generations have access to nutritious foods while safeguarding the planet. From the analysis done on this sample, we cannot assume that healthier diets will always have lower environmental impacts. Increasing fruit and vegetable intake is frequently recommended as a component of a sustainable and healthy diet. However, without changing quantities consumed of other food groups, particularly animal source foods, the environmental impacts may not reduce, and in some cases could actually increase. In this sample, those in the healthier group, i.e. eating more fruits and vegetables, had the highest water footprint but lowest carbon footprint. Further, the environmental sustainability of this group's dietary patterns could change if other metrics were assessed. So I just presented on dietary greenhouse gas emissions and water footprint, but if land use was assessed or eutrophication potential, these diets could have different sustainability outcomes. There is very little discussion in the literature on the contribution of energy dense, nutrient poor foods, or discretionary foods as they're coined, caffeinated beverages or alcohol. These were omitted from the Eat Lancet diet, so there was no recommendations given for their consumption levels. And these foods were the third biggest contributor to carbon and water footprint in the least healthy group. So they're definitely foods that need to be further looked at and understood about their impacts on the environment. The literature has shown through modelling that significant changes towards healthful plant-based diets will have population and planetary co-benefits. The research is clear that animal-based foods are typically more resource-intensive and environmentally impactful to produce than plant-based foods. So the next steps is to apply these dietary recommendations to the cultural context. Currently, a lot of the research is based on modeled or hypothetical scenarios. So we need to further expand and apply these to a cultural context to see how sustainable and healthy diets would play out. For the dietary shift that is required, that being mostly plant-based diets, individual agency will be necessary. However, it is the upstream interventions which are prerequisite for any individual behavioural change. Upstream interventions that address the commercial and social determinants of health are crucial to build synergies between nutritionally healthy and sustainable diets and ensure the adoption of these diets. And lastly, I would just like to acknowledge Dr. Janice Harrington and Dr. Sinead McCarthy for their supervision of this work. And thank you for listening. And I look forward to the questions.